Greetings, everyone. It's a pleasure to be back again. And today, as I promised in the last session, we're going to talk about the role of pharmacists in self-care. I hope you learned from the others and you're gaining more insights on what capabilities are there for us as pharmacists in practice. So today, I'm going to talk about self-care. This particular episode is inspired by some conversation that I had in the course of the other week. And one of them was involving an interview where I was contributing in terms of what can we do as pharmacists in shaping self-care. But at the same time, also look at it from the dimension of what's happening in our industry and what are the drivers to this particular growing aspect on care when we look at it from the healthcare space. And as a pharmacist, I would be critical about what can I do as a pharmacist? What space is there for us to actually contribute to delivery of quality healthcare services and products to patients and to support them in the journey to attaining wellness that is everybody's aspiration and every patient's desire in life. So the first thing that we have to acknowledge is we have to understand that self-care is the ability for an individual to take control of their life in terms of their wellness, healthcare needs, without depending on a healthcare provider to be the one delivering that care. And the best approach that can happen is they have to get access into the right information that can enable them make the right decision. Once they get the right information that's enabling them to make the right decision, to intervene and to act on those decisions, then that is what we look at in terms of self-care. So the question is, how do we enable patients, we enable members of the public to actually take charge of their wellness in terms of their healthcare needs and to act on that? So bit is information, and two, when they're taking that action, some of it will involve healthcare products and technologies. Then the other bit is how do we make these available? And in all that scope, when we talk about it from the aspect of information to the products themselves and the technologies, there are regulations that govern whether they're being made available or not being available. There is the innovative component on who is developing these technologies and what insight is deciding on when, how, and to what extent they need to develop these technologies. I'll talk about some of the critical ones that we all know. When we talk about sexuality and sexual education and related, everybody is talking about access to contraceptives, access to, let's say, the fertility products and related. And I would focus on the contraceptives majorly. For example, the condoms that are the most prevalent, the most used. These are self-care products. And for them to be used, they have to be available. And for anybody to use them, they need to know the value of using them. So if we are not going to give that information, we are going to negate the value of self-care. And therefore, the people who would have used the protective, that is the condoms and all, those, one, they're at risk of getting unwanted pregnancies. Two, they're at risk of getting sexually transmitted or sexually acquired infections. And that is a risk for us. So is that what we want? Not really. So therefore, our contribution is enabling these people to understand the benefits of taking charge and taking control of their wellness. And two, in supporting them in accessing the products they need to take charge and control their lives. So that is where we come in as pharmacists. So in terms of that scope of pharmacy practice, you need to look at it from the health promotion, disease prevention, that is the infection prevention and control measure. That is the first phase of care. So as members of the public, we need to enlighten them to have everybody literate. Health literacy has to be driven. And one of the key advantages that we've gained from COVID-19 is the fact that every news media channel, whether social media, the mainstream media, newspapers, print and non-print, every one of them has been keen on sharing health information. And therefore, as a result of COVID-19, most of the populace is informed about healthcare and some aspect in health. So the health literacy is higher. But the question is, how do we make this translatable and transferable to other aspects of our healthcare needs? Over COVID period, the most critical bit, hand washing, hand hygiene, use of sanitizers and related. It is a good aspect in terms of preventing COVID, but the same particular knowledge and insight that we've gained can now be transferred to other areas. For example, when we're talking about infectious diseases, the waterborne diseases, cholera, diarrheal diseases that kills so many children under 5 years across Africa. So what can we do to transfer this kind of literacy now and apply it in the context of what diseases are we suffering from in our communities? So the scope, we started one in terms of the infection prevention and control. Then the second bit, once people are already informed about how they need to take care of themselves in terms of preventing and getting these products, then the next phase is, how then do you get the products that you would need to attain autonomy and to the point of self-determination? Because everybody wants to be in charge and in control of their own wellness and well-being. So that is where now we look at it from, are we making these products available? And I would talk about one other aspect is just within the sexual reproductive health space. We talk about menstrual hygiene products. These are self-care products. But then for people to access them, we need to look at from what angle are we dealing with them. Generally, the people who have the financial muscle and the financial ability would be able to procure them. But at the same time, we have to acknowledge that we're dealing with a society where there are disparities in terms of economic levels, and therefore, in that scope, there are people who might not be able to afford these menstrual hygiene products like sanitary towels and related. So how do we make them be able to access them? And that is where now, as pharmacists, we could promote the aspect on self-care by positioning ourselves through the community pharmacy outlets where we operate as key centers of excellence in terms of distribution points for access to menstrual hygiene products. And being the government is keen on looking at how to provide these, especially for school-going girls, we can be position ourselves to enable the government to deliver on that. And as we support the government, we're designing a new model of public-private partnership where, as a private pharmacy owner, I'll be able to support the government in achieving its mandate of ensuring every school-going lady has access to menstrual hygiene products they need, and therefore their retention and continuing education is enhanced. With more educated girls, the economic development of the country is there, the prospects of their future lives, whether at a personal level or even the communal level, is enhanced because of that particular contribution. And then we could look at now the financing component, which I believe in the previous episode that I talked about, you need to look at some of the interesting insights that I shared and look at how do we plug those into this kind of a model that we are working with in this space. And the other aspect that we could look at, like use of digital technologies. WhatsApp platforms are coming in place. People want to converse and share information. Maybe somebody is unwell somewhere, but they want to take care of themselves. They are able to converse with you. And in the marketing component, one of the critical bits that came with the advent of technology was marketing became democratized. And therefore, instead of pushing information to clients, you're making it accessible for them to use it. And where they were not able to, opening a channel where they could reach out to you. So therefore, we have the bi-directional or multi-directional conversation between the service provider and the consumer of that service. So now we need to look at it from, are we establishing such channels as pharmacists to ensure that self-care can be driven and can be promoted in our areas of work? So those are other aspects that we need to look into. Then as we go further, the policy component, the policy regulations and guidelines that are in place, these are supposed to be enabling us to be able to access products and the services that we need, and majorly on the products level. And when we talk about a pharmacy perspective, we are looking at health product technologies and majorly pharmaceuticals. Some might be restricted, some will not be restricted. And that is why we have schedules where we have over-the-counter medicines, which can be accessible to the general public, but at the same time, we also have the prescription or the pharmacy only, which can be only dispensed under the guidance and care of a qualified healthcare practitioner pharmacist, or on prescription by a qualified medical doctor, physician, or clinician, depending on what the law provides for that, or even a nurse. So those are the different categories. So the question is, in terms of that scheduling of these products, are we making them available for the general public to access them for the over-the-counter medicines? If that is happening, then we need to look at what are the scope of products that are available there. What are the needs of the general public that will enable them get them? Because failure to ensure that the over-the-counter products or the self-care products that people would generally need, not for a disease state, but to improve their well-being, might not be accessible. And therefore, the unscrupulous dealers will come into the market and they'll provide substandard, fake, falsified ones. And when these are available, they're compromising on the health of the public rather than supporting them to attain the positive health outcomes that we all wish for. And we have to be critical about that. And one area that has proliferated is in the cosmetics and beauty products. There's so much of beauty products that are laced with not so safe components. And this is because we have a lax in our regulatory systems. And we, as pharmacists, maybe we've not gotten to the point where we contribute to regulations and also in ensuring distribution channels are in place to ensure that the legitimate quality products are getting to the end patients who really need products from us. So we need to take charge and see how are we going to drive that. So in the terms of drivers, as I look at it in other than the scope, the innovative component is also within the scope. And that is how we can look at how do we innovate to deliver solutions. Even now we have some of our pharmacists who are developing products, some are in the beauty industry, developing beauty products based on management of acne, which is a critical issue. But now being a pharmacist, you can design that solution and give it to people by ensuring access to that. And those are some of the things that are happening. Then beyond that innovative aspect for the beauty products, there are those who are now working on reusable sanitary towels. Are we making such? What are we doing about them? Menstrual hygiene, when we talk about it, it's a critical area that I'm keen on talking about, yes, because when we talk about menstruation and related, every other person is talking about access to the menstrual hygiene products. But who is talking about the menstrual pain? Can we as pharmacists collaborate with other stakeholders within the industry to find mechanisms to manage the associated pain? Because somebody would not come to the hospital to be managed for the pain associated with menstruation on a monthly basis, but we can design a solution that can enable them to be able to live without having to come to the hospital, without coming to any other institution to get care, and also to live a dignified life without feeling ashamed of the pain and the distress that they go over that period. So what are we doing? And once we understand that is the scope of work that comes in for us as pharmacists, then we now need to ask ourselves, what are the drivers to self-care? What would make me want to support self-care? What would make patients and the general public have access to? One thing, stakeholder support and adoption. How many people are inclined to self-care? Do we have the general public who are inclined to seeking care from you so that they can manage their affairs on their own? Definitely at this particular moment in time, majority of patients don't want to be reliant on doctors and healthcare providers. And that is why we now have the Google doctors in place, because when I'm unwell, I want to go to an online platform, seek the information, find out to manage my condition and move. Nobody has that time of going to spend 6 hours waiting in a queue somewhere. So that is the convenience era. Are we meeting that convenience and are we supporting the patients? Then the patient support networks, organizations, are we with them? Pharmaceutical industry and related industry players, are we engaging so that we see some companies producing self-care products? As a pharmacist, I'm at the point of care that I'm delivering solutions to patients. Do we have an interface of integration where their products, the quality products that have verified, are made accessible through my channel to get to the patients? Because if that doesn't happen and there's no distribution channel, then there's no way that the patient can depend on me delivering that solution to them. So what are the components? When we look at the multidisciplinary practice, I have physicians who are serving somewhere, and I'm at the pharmacy. Therefore, if a patient comes and let's say we have a digital watch that is there monitoring their vitals and related, I need to be able to access that information. And once I have it, I need to be able to converse with a physician somewhere. Then we find a way that we're managing our common patient. If that is in place, that a framework, we can collaborate and share information within the network, we are promoting self-care. If that doesn't happen, we're going to lose at the end of the day. And that would either support or fail to support self-care. Consumer and patient empowerment. I mentioned that when I'm talking about literacy. When talking about financial capability, ability to procure these, for example, the digital devices. We're talking about HIV self-test kits. Anybody who can use them has to be enlightened because they need to know how to handle the rapid diagnostic kit. They have to be able to afford that diagnostic kit going for $5 currently in the Kenyan market. So how do we meet those kind of needs? Then we look at policy, as I was talking about the scope of practice. Who is regulating them? And how do we ensure regulation is enabling patients to be able to access the quality ones? As I mentioned on cosmetics, some patients would rather go to a hospital and spend 6 hours because in that case, they're sure they'll get the quality product and there's somebody to take responsibility for it. In the infiltrated informal markets, there's influx of counterfeit, substandard, and the fake ones. And therefore, there's a risk of impacting their own well-being. And the option is they either go to the hospital to get the quality one, or they use this one to get affected and therefore decline use of these products. And by them not using it, their wellness is not promoted, but they'd rather suffer from the condition that they're experiencing than expose themselves to more harm. So the question is, are we looking at strengthening the policies and the regulatory environment within which we operate to ensure that we are promoting self-care? And the most important thing, every human being wants a sense of self-determination, and we need to give them that chance to be able to stand for themselves, to get the support they need to lead healthy lives. Pharmacists, this is the time we need to take charge, and we need to take charge by thinking beyond what is the standard. We've been dispensing medicines, yes, or counseling when it's necessary, but now we need to look at it from actually reimagining the whole ecosystem, looking at how do we position ourselves to serve our patients. And it's not only patients. When I talk about stakeholder engagement levels and all that, I need to look at who is producing the pharmaceutical product or the healthcare product and technology that is going to support the patient in achieving the positive health outcomes. Whether it's a diagnostic firm, it's a medicinal product firm that's producing it, a health product, any device, what do they do? and how is it needed based on the market in which I'm operating in. Then if I can understand that dynamic, then I become a bridge, because I understand the patient that is depending on me to deliver quality care. But on the other end, I'm also depending on these people to produce the quality ones. I ascertain the quality in terms of looking at the regulatory requirements and all that is met. Then I bridge that gap by bringing these products available to me. Then coupled with my specialized knowledge as a qualified professional, I'm able to serve the patient by giving them the right information on how to use it, how to monitor, and even considering having long-term engagement mechanisms that will ensure that happens. And in that mechanism, we need an incentive, because at the end of the day, we need to make a living out of what we do. We have to think of the financing mechanisms to deliver these quality solutions. And once we do that, then we're on the best track. And as it stands now, the regulatory systems are not as robust as we would wish for them to ensure we support self-care. Therefore, that is a place for us to act. And how to do it is plugging into the different networks and associations that we engage, and ensuring that as we do that, we are shaping the future not only for the day tomorrow, but the next century, the next decade. How do we envision that future? What are we doing to make it happen? And are we creating those platforms and networks that are going to ensure that we have infrastructure to deliver on the aspiration on every single individual, wherever they are, to be able to decide how they want to lead their lives, exercising and all. Are we promoting literacy? Because all the people who go to gyms, they are informed about the benefits of exercising. If not, they would not be going. So how do we create that kind of an incentive for them? And once we do that, we are making a win. And all I would wish is we do our best to ensure we promote self-care and we promote wellness in our communities. Because we have so many conflicted priorities in life, we need something that doesn't need us having to spend time in other avenues, in other spaces where we would rather not go to. So I would want to go to work. I would want to work. But as much as I'm working, I need also to be healthy. So if I have a mechanism to stay healthy, which you can design as a pharmacist, I would be more than glad to have consumed that service or product. So make it happen and let's do that. Thank you so much for this particular episode. The next one will be going to talk about primary healthcare. And the reason as to why I'm looking at that in the next episode is the fact that most of us are looking at every policy intervention, every health system strengthening focus is on reaching patients at the local communities. And if that is the case, then the question is, who are the most accessible people from the community levels? Pharmacies. When I'm unwell, I'll go to the pharmacy to get my medicines. So then, how do we make these pharmacy servers? How do we integrate the pharmacy services into primary healthcare, where the policymaker would see the value of a pharmacist in primary healthcare? The general public will have to understand what value they can derive from that. The financing agencies and institutions see the need to engage with pharmacists at the primary healthcare level. And as pharmacists, we position ourselves by delivering quality services and being the go-to person at the pharmacy, at the community level, at the primary healthcare level. If we do that, we are going to drive that intervention for the future that we're wishing for. And I hope we get to engage as much as we can. For those who would want to reach out, Africa Pharmaceutical Network on LinkedIn, let's engage, let's drive the agenda for pharma industry in Africa together. Thank you so much. Have a good one.